all nursing home workers in our state will soon be required to have the COVID vaccine. WBZ's Beth Germano is live for us in Brookline tonight. And Beth, the state believes that the vaccine rates among those workers really should be higher.
Because the state is citing what it considers to be low vaccination rates at several long-term care facilities in the state, putting frail residents at risk. This is now the first statewide mandate, and one not everyone agrees with.
She is in a declined state of health.
And that's why there's concern from this friend visiting a loved one at a long-term care facility, that healthcare workers on the front lines haven't been required to be vaccinated.
And I'm surprised that any healthcare worker that doesn't get vaccinated, I would want to discuss with them, what the hell do you think you're doing?
But the Baker administration has now made it a mandate, saying the state's most vulnerable residents need to be protected. It says of 378 skilled nursing facilities in the state, 155 have less than 75% fully vaccinated staff. Infectious disease specialist Dr. Daniel Karitzkis says more education is needed.
The people who work in chronic care facilities tend to also come from underrepresented communities where there's less access to medical care, and there may be greater concern about new vaccines.
Massachusetts Senior Care, that represents nursing homes, says it supports a mandate. But the Mass Nurses Association says while it encourages vaccination, a mandate is too broad a call.
But we do also believe that since our members are represented by collective bargaining, they can sit down with management and have this conversation at each individual facility.
The move by the state comes amid concern about the spreading Delta variant and the fragile population in these facilities. But the question is, would a mandate turn people away from these demanding jobs at a time when they're needed most?
There is a delicate balance between forcing people or compelling people to be vaccinated and risk losing a significant proportion of your staff.
The Department of Public Health will enforce the mandate with exemptions only for medical or religious reasons. The first dose has to be received by September 1st, with staff fully vaccinated by October 10th. Reporting live from Brookline, I'm Beth Germano, WBZ News.